I think one more time we're looking at a very simplistic solution to a very complicated problem. And I think that, for me, is the real issue. Smoking is one behaviour. We know smoking one cigarette is problematic. I work with lots of children and young people, and when we start to get inside the diet, yes, fizzy pop, they will see at one extreme end. But then you move along and you start to say, well, what about butter? Do we need it on butter? It's very high in fat. But we might only consume it in small amounts. And so when you get into a diet versus a food, it becomes more complicated.
This is the start to something that could potentially be bigger. And I think things like fizzy pop and biscuits and crisps, like cigarettes, you have one and you want more. And I think initially people go to the shop with the families and they don't have time to look at things, and it's impulse buys. And I think with warnings like this, we could almost sort of change the way people think. Not
It'd
just
definitely work for kids,
this.
wouldn't it? They'd look at that,
absolutely.
they'd see it and think...
I'll tell you why it doesn't work for kids. It does in that instant moment, but what happens is over time, it makes those young people feel as though... What we've got to realise is children that have obesity they do it for a whole variety of reasons. It's not just about fuel. What our kids tell us, very simply, is that when people judge them, so they may eat a very balanced diet, one packet of crisps over the course of a week is not a problem. But at that moment that they're consuming it with a health warning on it, people say, that's why you've got your problem, because you are stupid. And that's what our children tell us. It makes them feel really uncomfortable, makes them feel depressed, makes them feel anxious about that one behaviour.
Just a few years ago, you were 8 stone heavier than you are. How did you get to that point? Because, I mean, what Paul's saying is you don't want to be told all the time that what you're eating is really bad for you and that you must be stupid if you're eating it, because actually sometimes they can't stop, because you found yourself in that situation.
Yeah, I mean, it took me 2 years and a lot of self-control, but I believe these sort of labels would have helped me. Maybe I might have not have been obese if I could have seen labels like this in the shop. It might have put me off initially. A lot of people impulse buy, and seeing that sort of helps your self-control. I mean, obesity is at the highest in age 10 to 11, and I believe for parents and people working full-time, this could help them, and we could help generations in the future as well. I think it'll make people think more about what they are buying.
In tackling obesity, what we're doing is looking at very simple solutions to a very complicated problem. And in many ways, this takes government off the hook for working with and supporting children and young people. We have 4.5 million overweight and obese young people in this country. We have as was talked about earlier, we have about 400,000 children in the UK that are so obese that if they were adults, they would be immediately eligible for surgery. There is services in England for 150 of those children. You cannot tell me that is an effective healthcare system. And these things will not have an impact on children that currently have severe obesity. They are so far gone. And that's the problem, that this takes the emphasis away from what we should be doing out there.
But they could argue it might prevent more people becoming like it. Although, having said that, I don't know, but I'm old enough to remember when those really stark warnings on cigarette packets came in. And at the time, they brought out some cigarettes called death cigarettes that had really, like, sort of skull and crossbones. And do you remember them? And it became a badge of honour for people to smoke them. That's the problem. Actually, the starker and scarier, it could have a flip side.
Yeah. Well, they actually tried this in Australia, and it worked in Australia, and I believe
the British Heart Foundation tried this about 5
years
years ago. British Heart Foundation did a massive campaign with children and young people. Had no impact whatsoever. Did all the same thing. Actually, some of the images were worse. So they had a girl that was drinking oil and it was pouring down her face. Had no impact whatsoever. Because we switch off to those sorts of messages.
I think we absolutely need to do something. And I think if this could work for obesity in the UK, I think we should definitely give it a shot. I think people need to see things like this again to remind them, you know, if you constantly eat and drink things like this could happen to you.
Believe me, I've been working with thousands of children for the last 20 years, and if this was a simple solution, I would have adopted it a long time ago.
And in the last 20 years, the obesity rate has risen.
Gone up. Because there's
I
no
believe
effort
we
on
need
this
to do
issue.
something, implementing this while they're young, so they can grow up with a different mindset and eventually have a healthier lifestyle, and then they will take that with them and bring their children up the right way. And I believe eventually.
That's the education that
Yeah.
undoubtedly Paul would agree with. John says, interestingly, I can do a whole week's shopping for 30 quid, but if I want to eat healthily and go healthy, it would easily be £70. The only way to get people eating healthy is to make junk food more expensive and healthy food more affordable.
See, I disagree with this.
You don't
I believe
think
if you plan your meals, you prep your meals, and you make, you know, big batches of them for the family, you can freeze them. I believe you can still eat at reasonable price, a lot healthier.
That is true. But most people can't do it. We live busy lives, you know. People are working longer hours and commutes and things like that all mean that, in theory, that is absolutely right. But in practice, that is incredibly difficult for most normal people to do.
You two aren't going to agree, but I think you do both agree that something needs to be done.
Absolutely,
So it's great to chat
Thank
to
you
both
for coming
of
in,
you.
Jennifer.